Clinical Crown Lengthening. Clinical crown lengthening is a surgical procedure designed to expose more of the tooth structure by reshaping or removing gum tissue and, in some cases, bone. Types of clinical crown lengthening. There are 4 primary types of clinical crown lengthening. Gingivectomy. Removing excess gum tissue without altering the underlying bone. Undisplaced flap with osteotomy, elevating a flap and reshaping the bone without repositioning the flap. Apically repositioned flap, elevating and repositioning the flap apically after bone reshaping. Combined approach with orthodontic extrusion, integrating surgical procedures with orthodontic techniques to achieve optimal results. Indications for each procedure. The choice of procedure depends on specific clinical scenarios. Gingivectomy, used when there's excess gum tissue and sufficient attached gingiva. Undisplaced flap with osteotomy, indicated when bone removal is necessary and there's adequate attached gingiva. Apically repositioned flap, preferred when the width of attached gingiva is insufficient, necessitating both bone removal and flap repositioning. Combined approach, employed when surgical crown lengthening is complemented by orthodontic tooth movement. Surgical steps in crown lengthening. The procedure typically involves anesthesia and caries removal, administering local anesthesia and addressing any tooth decay. Measuring attached gingiva, assessing the width of the attached gum tissue. Gingival incisions, making precise cuts to contour the gum tissue. Flap elevation, lifting the gum tissue to access underlying structures. Bone removal, reshaping or removing bone to achieve the desired tooth exposure. Suturing, securing the gum tissue in its new position. Key considerations in crown lengthening. Important factors. Anesthesia, ensuring numbness in the area, typically covering 2 teeth on either side of the surgical site. Gingival measurement, evaluating the keratinized gingiva and using bone sounding to measure the distance to the bone crest. Ideally, this distance is 3 to 4 millimeters. Gingival incision techniques. Incision methods vary based on the surgical area and the amount of keratinized tissue. Minimal keratinized gingiva, a submarginal incision placed 0.5 to 1 millimeter from the gum edge. Adequate keratinized gingiva, an external bevel incision at a 45-degree angle to the tooth's long axis. Apically repositioned flap technique. This technique is used when there's insufficient keratinized gingiva and minimal need for gum removal. The gum tissue is repositioned apically to eliminate pockets and increase the width of keratinized gingiva. It's contraindicated in cases with significant bone loss or in aesthetic zones. Visual, a smiling patient with improved dental aesthetics. Achieving optimal results with crown lengthening. Clinical crown lengthening is a valuable procedure for enhancing both dental function and aesthetics. A thorough understanding of the various techniques and their indications ensures optimal outcomes for patients.